Hi, I'm Maya McNulty. I'm the founder of COVID Wellness Clinic, and I'm also the New York State captain for COVID Survivors for Change. I'll be participating this weekend at the press conference and walking across the Brooklyn Bridge with hundreds of other long haulers and marching in solidarity of friends and family members that have lost loved ones to COVID. I'll be sharing my speech with you today in case you cannot make it, but I would love for you to attend and be part of it. Your prayers, your support, your love, it means a lot. And so thank you for listening, thank you for sharing, and I'll put the link in the comments in case you have the opportunity to attend. We'll be marching across the Brooklyn Bridge at 11 a.m. on Saturday, August 6th. And this is my speech. I hope you like it. Thank you, COVID Survivors for Change, Yellow Heart Memorial, Faces of COVID, Survivors Corp, and everyone here for attending this second annual March to Remember for our beloved friends and family members who lost their lives to COVID. We acknowledge the unimaginable death toll of 1 million lives lost to COVID, 250,000 children orphaned by COVID, and the over 23 million long haulers who are living with the bitter legacy of COVID-19, and that number continues to grow today. The health of our society matters. The CDC estimated that 1 in 5 adults suffer from long COVID. Our well-being is still beyond reach. 885 days. That's how long it's been since I have been suffering and struggling with the train wreck of long COVID. Long COVID is a unique compilation of diseases that manifest differently. I've been struggling with 50 of the 200 long COVID symptoms, such as cognitive dysfunction, chronic cough, neuropathy, insomnia, shortness of breath, heart palpitations, fatigue, tinnitus, and the loss of feelings and the debilitating effects of my hands and feet numbing up. After 29 months, it's troublesome to learn that these debilitating symptoms are critical and not getting the attention of healthcare and government. The misattributing of symptoms are at an alarming rate as many new wild cards of variants emerge and need to be understood. I'm Maya McNulty from Niskayuna, New York, and I'm the New York State captain of COVID Survivors for Change, and I've worked in support of scholarships and baby bonds bills. The bill was drafted and introduced early March of 2022 by New York State Assemblyman Angelo Santabarbara. I'm an author, a mom, a wife, a daughter, and pre-COVID I was a high-achieving entrepreneur who worked with thousands of people for more than 2 decades, creating jobs and opportunities. I battled the coronavirus early March of 2020. I was one of the first young females infected, and I was hospitalized for 69 days and was in a 30-day medical coma on a ventilator and trach for 6 weeks. I was clinically diagnosed as having long COVID September of 2020. I've had to relearn how to walk, talk, and eat normally again. I lost all of my hair and my voice for 10 months, and I'm still recovering steadily. I turned my pain into my potential by creating COVID Wellness Clinic, the online program to help long haulers from the comfort of their own home. COVID Wellness Clinic is dedicated to the support and education of families and individuals living with the serious and debilitating long COVID. You can learn more at covidwellnessclinic.com. Would it be okay if I shared a story with you? I can best remember while laying in my hospital bed. The pain felt like shards of glass. They were attacking my entire body, my skin, and my organs. The isolation, darkness, and hopelessness I felt when I couldn't see my husband and daughter for 69 days was heartbreaking. I was told that my daughter flew home from college in Colorado to say goodbye to her mom via Zoom from my hospital bed, from the hospital parking lot. So she was told to come home and say goodbye to her mom via Zoom in the hospital parking lot. All 3 of my lungs had collapsed and I had died from respiratory failure. This is one of my most tearful and painful memories. Under the care of medical professionals, I have regained 73% of my lung function in the past 29 months. I know that my story makes me one of the lucky ones, even though I don't always feel like a lucky one. I know at the dinner table there are millions of empty chairs, and these empty chairs, they belong to our loved ones. They are not just a number after 2 years into the pandemic. And when the pandemic first began and I was first sick, there are an estimated 23 million long haulers who are suffering in the aftermath, and that number continues to grow today. I'd like to share some of their stories with you today as well, too many of whom are being overlooked by their doctors and the healthcare system. Dr. Robbie Tamargo, she's from Florida, and she's a clinical psychologist for the U.S. Army, Navy. And she's a psychologist while in practice. She contracted COVID from a patient, and now she's no longer able to return to the Navy, the job she loves, and or her private practice. Cynthia Adding is a single mom from Northern Virginia, and she's been to the emergency room for more than 32 times in the past 2 years. Her symptoms have not diminished, but her son also contracted COVID and now suffers from long COVID. And another long hauler was told that by her dentist that long COVID is not a real disability. And a dear friend of mine, Robin Burke, whom I met during our support group on Clubhouse. Robin Burke's from Oklahoma, and she's struggling with vision issues, brain fog, neuropathy. Despite this, she continues to work with veterans. She treats inpatient psychiatric units because there's a staggering increase in the need for mental health and support and funding. Early April 22, we worked on a bill, and the bill is the Prevent Pandemic Act. We asked that Congress pass the Bipartisan Prevent Pandemic Act, bill number S3799, and that would include a congressional task force for COVID. We are still calling for COVID-19 emergency federal funding for Americans. And in New York State, we are working to support some of the country's estimated 250,000 children that have been orphaned by advocating for scholarships and baby bonds. These children need our help. And finally, we need healthcare education and funding so that the medical community can research, diagnose, and treat long COVID. I want you to know that you're not alone, and I see you. I'm Maya McNulty. I'm still 29 months a long COVID patient, and I'm honored to be your New York State captain for COVID Survivors for Change. God bless you and thank you.